Shabbat Shalom and a Gemar Hatima Tova to all the members of our community. Many people have been asking the question about people who have been afflicted with the coronavirus and fasting on Yom Kippurim. This is a very serious question, and we did a lot of research and spoke to many specialists, many doctors, many rabbis in this field. It's important to understand that despite all the research we have done to put together these guidelines, there are many different opinions amongst very top physicians in the field that have different opinions about this question, as well as do many rabbis. So therefore, although we've put together these guidelines with tremendous research, we do encourage that everyone should, aside of just relying on these guidelines, should speak to their personal physicians who know their specific situation before making a final decision. In addition, even a person who, based on the guidelines and even their doctor's recommendation, should fast, we ask them to carefully watch themselves throughout the fast, and if they have had coronavirus, they should keep a water or any other fluid near them just in case they start feeling a little dizzy. Then they should take some water based on the guidelines that we have recommended according to the appropriate measurements. So to begin, first of all, if you have a healthy person who never tested positive for coronavirus, but he was just in proximity or he was exposed and therefore had to quarantine because he was exposed to someone with coronavirus, that person should fast as everybody else. Also, a person who had coronavirus and was asymptomatic, had no symptoms, he as well should fast. But a person who tested positive for coronavirus and is still exhibiting symptoms, even some mild symptoms, but is still exhibiting symptoms, that person should drink minimally according to the measurements that we will discuss and provide. If a person who had minor symptoms, mild symptoms, and he is within the 5 days of the symptoms going away, he has not been 5 days symptom free yet, he should definitely attempt to fast and monitor himself to make sure that he is fine. And again, as mentioned, he should have potentially some fluid next to him in case he needs it. In case he feels faint, he should drink. After 5 days, a person should be fasting regularly, and again, even that person should monitor himself to make sure that he is feeling fine. Again, a person knows how he normally feels on a fast, the weakness. If it gets much worse than that, a person shouldn't take chances. A person who tested positive and experienced severe symptoms, could be a hospital stay, or he had pneumonia, serious vomiting, serious diarrhea, things that clearly can cause dehydration, he may not fast, right? And even up to 3 months after those severe symptoms, he should not fast. This person should not fast. He should at least drink according to the measurements that we provided. Any person who tested positive for coronavirus and has an underlying medical condition that is a severe medical, such as severe obesity, diabetes, or any other condition that will compromise his immune system, he should not just drink, he should eat and drink according to the measurements discussed. Now, what are those measurements? The measurements, when it comes to liquid, he should drink 2 ounces every 2 minutes, and the doctors do recommend that a person have at least 1 liter of liquid throughout the day. When eating, he should eat 1 ounce every 7 minutes, and that is the required measurements for those who need to eat or to drink under those situations. Another question which we were asked, which is about hygiene. We had this question at Shabbat Av. Obviously, in Yom Kippur, it's much more severe. Again, a person should attempt, in keeping social distancing, not to touch people, not to touch items that other people have touched. However, if one feels that he has come in close proximity and he is concerned that he may have touched something that can actually transfer corona or someone, he is, even though washing is forbidden on Yom Kippur, he can cleanse himself with a Purell or some disinfectant to make sure that he is not transferring disease to himself or to anyone else. I wish everyone a happy, meaningful fast and a safe holiday. Shabbat Shalom, Mar Hatima Tova.